Hello, good evening. Welcome to Candid Chat with Jackie this afternoon, this evening. Yeah, just trying to get some more people to join and then we can go ahead ASAP. Let's see if we can get some more people joining in, then we can start in a short while. Hello, good evening, welcome. Hello, hello, hello. Good evening, good evening. Hi. Hello, Ama Ahima. You're welcome. Hello, Ron Key Baby. You're welcome. Equal Beauty. Please, you're welcome. Um, do you mind hitting? Tapping on the screen. Hello, you're welcome. In a short while, I'll be inviting the guests to join so that we can have this conversation. But I want to say welcome to you all who are joining. This is Candid Chat with Jackie. My name is Jackie Hansen, and I am so privileged and very excited every time I have to come on here to host these live conversations. This year, I'm trying to make my life better by living my dreams of hosting these candid conversations. And so, yeah, you're welcome. You're welcome, and thank you for making my dreams take flight. Yeah. Good evening. You're welcome. Hello. You're welcome. So, if you have any friends or you have siblings who, or you yourself, you are a nurse, or you have these friends and siblings who are nurses and are seeking opportunities abroad, especially the UK, today our guest will be helping us understand how to take the initiative, where to go, how to go about it, and all that. And so it's a good place to be, and it's also a good opportunity to tell someone the nurses and all those who are seeking to travel abroad to go and continue their careers there. Please do well to share this live with them. And in just a few minutes, I'll be inviting our guest so that he can come and we would have this wonderful conversation. But in the meantime, please do share the link and then let's invite people to join, as many as we can, to join this conversation so we can go ahead. And please, when you come on, do hit the screen, like double tap the screen so that just send some love my way. Yeah. Thank you. Let me see. Please invite your friends, especially the nurses, all those people, yeah, to join us ASAP so that we can have this very important conversation. I'm just trying to connect the guest so that he can come on board, like now. Yeah. Would you kindly double tap your screen so that just send me some love? That's all I'm asking for. Yeah. And kindly do share the link so that as many people who are seeking opportunities abroad, those who are seeking to work outside of Ghana as nurses can join. But guess what? This is not just about those who want to, this is not only for nurses, right? It's not only for nurses. So there she goes. That's our guest. She's just joined. Hi, Alison.
Hi, Jackie.
Good evening. I wish I could see your face.
I'm trying to set that up.
Yeah, trying
Can
to
you hear
set
me
it
though?
up.
Yeah.
Yeah, loud and clear.
There you go.
Awesome. There you go. It's so good to see you.
I
You guys forgive me.
know.
Whenever
I
I see my
know.
people, whenever I see my people, I get crazy. Like Alison is my person. I've known Alison for how long?
A
Almost a
very long
decade.
time. Yeah.
Yeah, like
A
more
very
than a
long
decade.
time. It could
Like,
be more
has it
than a
been that
decade. Yeah.
long? Now
The
I
time
feel
just flew
so
by.
Oh, come on. It was
Can
just
you hear me though?
yesterday.
Is it clear enough?
Loud and clear. Loud and clear.
Okay.
Thank you so much for coming, Alison.
Pleasure, 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 pleasure.
So, Alison here has the nickname Alison, your favorite nurse. She's everyone's favorite nurse. So, normally I like to put my guests on the spot, just a tiny spot, just
Jackie,
small. Okay, so Alison has was working at Trust Hospital and then she relocated
right,
to the UK. So
right.
Alison, you are in UK, like your first
Mm-hmm.
time. Let's go. How long has it been now?
3 years and some months.
Okay. So what was your welcome cultural shock that made you feel like, hey, tell us about it.
The weather.
Oh, how
So
bad?
I knew it was cold, but I wasn't sure how cold.
Mm,
So usually I can't stand so much cold. Even in the AC, I can't do 16 degrees. So in my mind, I thought, okay, maybe 16 degrees cold or 17 or 18 degrees cold. Well, I can manage that. So in the airport, it was okay. I was like, is it the weather people were talking about? Then when I had to step out of the airport into the bus, oh my God, it's like, no way. How am I going to handle this? Well, it was 8 degrees on that day. I remember quite well. It was 8 degrees. I said, no, can I switch off the AC somewhere?
it's like you are welcome.
Oh dear. It was the weather, honestly. It was the weather. Yeah.
So 3 years down the line, have you adjusted? Does
Not
it get
really.
better?
I think with every winter, you think, oh, this year is colder than last year. Yeah. But you learn to dress better for the weather.
Mm,
Because
mm.
previously when I came, I wasn't sure. When I see people wearing just one layer of clothes, I'm like, how are you managing in this weather? But I mean, puffy jackets, um, fleece lined clothes, covering up as much as you can, all helps to keep you warm. So I've learned over the years.
Okay, that's nice. So, when you were leaving Ghana, obviously
Mhm,
Ghana is warmer. I mean, it's even hot. What am I saying? Warm? It's hot, right? So, just for the benefit of those of us who have not yet been there,
mhm,
there was this one time I went to the airport and I saw people dressed very funny. I mean, just by their outfit, you could tell that they were moving into a colder zone, right?
mhm, mhm.
But
Winter jackets
do
and
you
things
dress?
in
Do you
Ghana.
dress in layers?
Of
Do you
course.
in Ghana before you go?
No, 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 no. I didn't do that. I didn't do
Hmm.
that in Ghana. So I had a winter jacket. So I was wearing something like a sweater. That's what we call it in Ghana. A sweater like this. But I had a winter jacket, which I
Okay.
wore before I stepped out of the airport because we were told that, oh, it's going to be cold. But even with that, I wasn't sure how cold it was going to be. But I wore a sweater and I hope I held that one just before, I mean, wore it before coming out of the airport.
Okay, so there you go. If you are planning on, I mean, trying to, don't wear your winter jackets in the Ghana airport. Please don't see that. Like, you don't see that. Okay, so Alison, tell us,
Yeah.
had you always wanted to become a nurse?
Um, hmm. Honestly, I'd wanted to do so many things,
Okay.
including nursing. I'd wanted to be a nurse. I wanted to be a flight attendant. I'd wanted to be a journalist. I'd wanted to be what else? I think I had a couple of, even a medical doctor. I had a couple of professions in mind that I wanted to do. I wasn't so bent on doing a particular one,
Mm.
but I did science in secondary school. So it means I was going to toe the science lane. And after secondary school, I happened to have told the nursing, I mean, trajectory, which has brought me where I am now. And in the beginning, honestly, I wasn't sure. I hadn't been to the hospital so much. All I remember about nurses was when I was little, they give injections because I
Mm.
pretty much that was it. I had not been in the hospital setting to see what exactly entails in their job. So I went in blindly, I should say, and there was quite an opener. Sorry, the kind of things I wasn't expecting to see, the kind of sacrifices nurses make, and all of that. So I learned along the line.
Wow. Wow. And here you are today. So your
Hmm.
first nursing job, where was that? Which hospital?
So I did my service in Tema General Hospital,
Okay.
but first paid job was at New Crystal Hospital.
At Ashaiman or Quincy
Yes,
Man?
Ashaiman.
Oh wow. Okay.
Yeah,
Okay. Okay.
yeah.
Nice. And then
That was
eventually
my,
you
my
moved to.
and I worked at Lister for a while, Lister Hospital for a while, and then went back to school. Then after school, I went to Trust Hospital.
Okay. So I know that your transition from to the UK began at was at Trust Hospital,
Yes, yes.
but was it always in the plan somewhere to relocate?
No, truthfully, it wasn't. Because I remember in nursing school, people were, oh, koye nursing, I'll bet me aqua and all of that. But it wasn't a plan for me. I loved to nurse, to practice in Ghana. But along the line, plans changed.
Hmm.
And I wanted to take the opportunity to, you know, try working outside Ghana to see what the nursing entails there because they usually used them as benchmark. When you practice in America, when you practice in UK, in the West, nursing is like this. And sometimes the things we learned in school were standards from here. So at some point, life is happening. You change plans, you change decisions, and all of that. So that's what actually happened.
Wow. Wow.
Yeah.
Right. So if you're just joining, we are having a conversation on if you are a nurse, you know someone who's a nurse who is seeking
Mhm.
opportunity to practice outside of Ghana, specifically in the UK. Alison here is sharing her experience with us, how it has been so far. She's been working in the UK for the past 3 years. Okay.
Mhm.
So now whatever you had to do. But first take us to how did you get registered with the is it the NMC, right? Is it
NMC,
what you
yeah.
is that what
It's
you
still
call it
NMC
here?
here. Yeah, yeah.
Okay. So what's the full meaning anyway?
Nursing and Midwifery Council.
Okay. Okay.
Yeah.
How did what did you have to do? I mean, who did you talk
Okay.
to? Where did you start from?
So I had friends who had already started the process. So it was easier for me because they knew where to go to. You had to initially register with the UK NMC online.
Okay. So that's the
Yeah.
first
And
step,
that's the
right?
first step. And
Okay.
registering with the UK NMC online means that you have to do verification with UK NMC in Ghana.
Okay, there's an office for that.
Oh, yeah,
Yes.
yeah, yeah. We have NMC in Ghana. NMC, Ghana Registered Nurses and Midwives Association or Council, all of those. There's a big thing in Ghana. So you pay. I think I paid a commercial bank. It's a commercial bank still, GCB Bank. Yeah,
Yeah.
you make payment there. You go and send your receipt to the NMC in Ghana. They'll put your details down, and all of this will be when you've already started the registration process with UK NMC. So they have a way of liaising with the NMC in Ghana to be sure that you are not owing the government, especially if you went to a government institution, because they pay for your tuition. So you have to work to serve the government for a number of years. So those who don't meet that requirement have to pay some money off. So just so we don't take nurses who owe the government out of the country, this verification process is quite important.
Oh,
So, but I didn't go to a government school, so it was easier for me. Yeah.
okay.
So you just do that verification. They liaise with the Ghana NMC. Once you are cleared, then you can register for the exams. So the exams, we have a nursing exams, it's called CBT, computer-based test, which is written in Ghana. So what happens is that until you are cleared with the NMC, you cannot register for that exams.
Okay.
So that's what happens. You register based on your specialty. So they had, if I remember clearly, pediatric nursing, midwifery, uh, perioperative, critical care, and adult nursing. These five. Critical care. I'm not sure, but I think there's mental health too. I'm not too sure about that. So they have these specialty areas based on where you have, specializing. You take that exams, and then that also determine which field you work in when you come to UK because you can't be a general nurse with general nurse pin and then go and work in a different department. Sometimes they allow that based on the hospital you're working in, but eventually they'll require a pin for the specialty. Yeah.
Wow, wow, wow. Awesome.
So
So
that's
if
just
you're
one
just
part of the exams though. one part of the
Okay.
exams. So you need to write the CBT, IELTS, that's the English exams. And then there's a practical exams which is done only in UK. It's called the OSCE. So it's a structured exam.
Oh,
It's like practical exams.
okay.
So
So
what
at
you have
what
to do
point
is,
do you write the UK exam? Still
okay,
in
when
Ghana
you
or when you get there?
no, 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 it's only in UK. You can't do it, I mean, remotely. You have to be
Okay.
physically here. So what the NFC allows is you can do the CBT in Ghana, IELTS in Ghana, and the IELTS, they have a requirements to meet. Once you meet these two requirements, the hospital that you're coming to work with can employ you. And then when you come, they train you for the practical exams. You go and write that. Then you get your PIN to work here in UK. So you don't get your PIN before you move.
Oh.
If you get your PIN before you move, it means that you're coming here to write the exams by yourself, the OSCE by yourself, before you start looking for a job. Yeah. But otherwise, most at the time, most of the hospitals, we call them NHS.
Mhm.
Most of the NHS trusts would bring you in when you've passed the OSCE, sorry, the IELTS and the CBT, and then they will train you to write the OSCE from here before you can get your PIN to be a qualified nurse. That's how come you start as either a band 3 or band 4, because until you're qualified nurse, you can't be a band 5 nurse.
Oh, oh, okay. Please,
Yeah.
if you're just joining, we're having conversations on how you can relocate from Ghana as a nurse and work in the UK as a nurse. So
Mhm.
you can just give me I mean, just double tap the screen, give me some love. Yeah, that's it.
Yeah.
And so, look at me being a TikToker today. Oh.
I'm not
Anyway, so
surprised, really. You've come
yeah.
really far with all of that, so I'm not surprised.
Yeah, thank
Yeah.
you. Thank you. Yeah, so I wanted to find out, do you
Hmm.
need to, for like very late people who they just want to do it but they don't know where to go to, do you need to be registered with an agency and the agency will guide you, or
No,
you can just do
no.
it yourself?
So there's been a lot of reforms in the past. Even right from the time I started my process and all of that, there's been a lot of reforms. So before I started my process, an agency could help you, guide you, do this, do that, help with the recruitment process and all of that. But they stopped those agencies from doing that. Then now the NHS would recruit directly. Once you've passed their requirements or their interview, then they'll hand you over to a recruitment agency to continue the recruitment and relocation process for you. Now there's another reform. Now they are not employing overseas nurses anymore, unfortunately. Yes, things have changed a lot over the years. So what people do now is they do the exams, the two tests in Ghana, look for money to come and write the OSCE here. Once they get the PIN, it's easier to get a job. But if you're waiting to be employed from Ghana, it's practically impossible now until things change again.
Oh, okay. Okay.
Yeah.
Well, then now let's talk about your experience. So now
Hmm.
this is a general conversation, not only
Yeah.
tailored for nurses, right? Now you're
Okay.
in the UK, you're working. You definitely have some experience working in Ghana and then in the UK.
Yeah.
What is it? Is there anything you love working in the UK more than working here in Ghana? You know the issues with our health systems, they are crazy.
A
Alison,
lot.
you
A
experience it.
lot. A
Not to remind
lot.
you, not to remind you, but I remember during COVID, right? You
Mm.
even lost one of your doctor colleagues, right,
Yes.
during COVID. And
Yes.
I'm sure
Yes.
that if we had proper systems put in place at that time, let's
Yeah.
talk about the health system here in Ghana and then
Ghana.
what you're experiencing out there.
Let me just say something funny. The first time I witnessed an emergency situation here, I was just standing there smiling. Somebody was dying, but it was just beautiful to watch. The emergency response is just beautiful. Once you pull a call buzzer for emergency, everyone stops what they are doing, unless you are doing an invasive procedure. Everyone stops what they are doing and rush to where the buzzer is coming from. They don't know what is happening. They don't know who is dying or who needs help, but you just follow where the buzzer is, I mean, going at. Everybody. So but within a blink of an eye, you see like 20 health professionals, doctors, consultants, nurses, healthcare assistants, phlebotomists, everybody's there.
And
Everybody's
then
there. and then somebody takes control over the situation. So I'm Dr. So and so, I'm the consultant so and so, who can tell me about the patient. And whilst the briefing is going on, things are happening. Everything is already there. Resuscitation trolley, defibrillator is there. Defibrillator is, you know, that thing that's when you're watching movies, that thing. Yeah. You hardly see some in Ghana. Oh yes, you hardly see some in Ghana. Sometimes a whole hospital doesn't even have. They only have in their theaters. Some do have it, but the personnel don't have the expertise to use it. So by the time they figure out using it once somebody is dying, the person will be gone. But here we go for training every year. Basic life support. How do you call it? We call it BLS, ILS. Every year, it's mandatory training. No matter how many times you've done it, it's mandatory for you to do it every year. And there are defibrillators even in town centers. So emergency happens in the town center. Say that again.
Is it the what did you say?
Defibrillator. Yeah.
I understand in the whole of Kolebu, there are
A
just a
few.
few. Right? Yeah.
And those, I won't be surprised if those few are in the theaters or maybe A&E or something. But trust me, most health professionals don't know how to use it because most of them have not been trained to use it. So somebody is dying, resuscitation, and we are not sure what to do. I have seen resuscitation in Ghana. I've seen resuscitation here. And like I said, my first time witnessing here, I was just standing there smiling. It was just beautiful. It was just beautiful. Everything you need is in the trolley. The doctors come prepared. There's a resuscitation team. They get their bleep somewhere. So you get doctors coming from different wards. I mean, coming to help. Health professionals coming from different wards. Critical care nurses coming from different places to come and help. So you are not alone trying to resuscitate your patient. There's help from everywhere. And that's how come they survive a lot here. Aside that emergency, care, equipment is quite advanced here. There are robots doing procedures, advanced CT scans, MRIs, all of that, laser surgeries, all of that here. Basic equipment like syringes, needles, gloves, it's in abundance here. And there are lots of safety precautions with these things. So in Ghana, we call something needle stick injury, like you're taking blood or giving somebody injection, the needle can prick you and you have to go through all the HIV screening and all of that, take medication in case the person has HIV or the result is not back and all of that. But here, the needles are not like that. They are different. They are needles we use for different things. And they have things that will cover, they have a technique to cover it as soon as you are done. So that needle prick, needle stick injury is minimized here. So there are lots of things that are really like never events. It shouldn't happen because they've put in all the safety measures to protect staff. Exactly. Yeah. So, and also trainings. When I got here, as much as I had over a decade of experience from Ghana, they don't assume that you know everything.
Yeah.
You still have to do a lot of training. Even fixing a cannula for a patient, you have to go for training, which we were doing in Ghana for so many years. NG tube, the most basic procedures that you've done over and over and over again, you still have to go for training to be cleared before, to show that you have competency in it before you're allowed to do it. Because if anything happens, the first question is, have you done your training on this? Yes. Okay, so why did that happen? Who ticked off your competency? All of these things come to play. Also, there's something we call duty of candor. Let's say back home, in Ghana, when I give a wrong medication to a patient, I will not own up. I may not own up. I'll just go and whisper to my colleague, yeah, mama will be wrong medication. No. You cover it up. It doesn't happen here. You make a mistake, you tell your supervisor, or you tell your in charge, or you tell your ward manager, I'm sorry, I gave this patient a wrong medication. You have to go and tell the patient that you gave him wrong medication. I was supposed to give you paracetamol 1 tablet, but I gave you 2 tablets. Sorry for the inconvenience. We'll observe you to see if you are going to show any signs of reaction. If not, da 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 da. So based on the medication that was given, overdose or underdosed, the doctor will come and request for some investigations just to make sure that the patient does not react to it. So you own your, I mean, you own up your faults and all of that, which doesn't happen in Ghana. Also, certain things that we didn't take into consideration in patient care, we call something holistic care, not just taking care of what the patient comes with, but trying to understand the patient's social, religious, and all of those things. We learn about all of those things in school, but the practice is not feasible because you hit a dead end at some point in Ghana. Here, if somebody comes with an abuse and the person is admitted to the hospital, you don't just treat the injuries and let the person go home. You have to report to a team we call safeguarding team. They have to look into the abuse, make sure the person is not returning home to the abuser. If there's
So you
anything
do
they
all
have,
that for the patients?
yes, in the hospital. If the person is homeless, you call the social care team, they'll find a home for the person before he's discharged. If the person needs nurses to be taking care of the person in the house, maybe come in the morning and give medications, come in the afternoon, give medication, come and do wound dressing, all of that. You do all of those referrals before the patient goes home. So we don't leave you that, okay, we've taken care of what you brought to the hospital. Now go home and sort yourself out. We take care of all of that before you go home. So it's really holistic care here.
Truly, indeed, holistic. Well,
Yeah.
wow. I see some more people joining. I'm so happy to see Amoyal Insurance join. Amoyal, it's good to see you. Thank you for joining.
Oh,
Yeah.
that's my friend.
I see. Oh, okay, so please, if you're just joining, we are having conversation around working as a nurse in the UK, like
Mm-hmm.
and the general conversations around
Yeah.
relocating to the UK, and also just show me some love. Just double tap your screen, and then yeah, just that. And if you're
Hi,
helping
Amoyal.
others join, yeah. Brad Betty, it's good to see you. Claudia, it's good to see you. Thanks for joining. Yeah, so Alison, let's talk about the no bed
Yeah.
syndrome. Is there ever a case where there are no beds over there?
Unfortunately.
There
But
are no
we
beds.
don't we don't turn you away.
Okay.
What happens is you don't get a ward, but you get a bed. So there's no instance where you come to the hospital where they'll tell you, we don't have the bed, go home. Never happens. So I'm not sure if you saw recently that they said some hospitals were nursing patients in corridors and all of that in UK. Yes. So one of them was my hospital where I work. And I worked just last night. We still had corridor patients. Unfortunately, during the winter, we have a lot of flu cases. And most of these people are the old ones who, immune system is quite low and all of that. So we don't turn patients away. We will take care of you, but you may not get a bed in a ward, but we'll take care of you. You be in A&E, make space in the corridors on a bed till we get a space in the ward. Yeah.
Well,
But
that's
we
fair.
don't turn patients away. No, not at all.
Okay. Okay. Okay.
Yeah.
Okay. So now tell us about this phenomenon. Oh, it's almost like a syndrome where in Ghana we complain a lot about mean nurses. So that
Okay.
sometimes nurses can be so mean and how they tend to patients and all that. How do you experience that also in the UK, and how are they like managed over there?
I want most nurses are pleasant here. Most of the nurses I've met here are pleasant. Most of them,
So,
your
Alison, let's
bosses.
explore this a bit further. Could
Mm,
it be, I'm just thinking out loud and playing the devil's advocate, could it be that the systems and the conditions we have here
absolutely,
sometimes make the nurses?
absolutely, absolutely. So let me give you an example. When I was in a nursing school doing my service, at that time we called it rotation. I did in a government hospital. It was at that time that I said to myself, I won't work in a government hospital ever because basic equipment were not available. There was so much pressure. One nurse taking care of about 20 to 30 patients, maybe the whole ward is just two nurses on duty, one healthcare assistant. The job was too overwhelming, too overwhelming. So you have to get relatives to do certain stuff for you. Pastor Person Jones of Anoko. Oh, mama, come do mami man aduane.
Like,
And those
oh
are
my God.
basic cares that we give as nurses. But the job is too overwhelming. You cannot do it. You cannot do it. So in the long run, there was a lot of neglect. So I said to myself, if I want to be a good nurse, I don't want to work in a government hospital. Somebody would disagree with me because they would think, why didn't you make a difference? Making a difference in government hospital, trust me, it takes a village. And people get exhausted because You fight the system, fight it, fight it, fight it. You meet a dead end and you give up. So what's the point?
Yeah.
So the lack of equipment, lack of consumables, pressure of the job makes it difficult to be a niceness in Ghana. I won't lie. Not to create excuses, but trust me, all these tell on you because in the middle of medication, somebody comes to tell you, "Me papa say Johnson dino. Me papa say sorry, me papa say over toilet." That's what they say. Papa say over toilet. Madam, me here draw fanako because you are in the you get it. It was so difficult. It was so difficult, honestly. So it was at that point that I said, no, I don't think I want to work in a government hospital ever because
You manage at
it
the
was
private
just too
hospital.
much. Yes, the private hospital were much better. They were more concerned about image, so they made sure that things were put in place. Sorry, my madam will be waking up. Things were
Okay.
put in place for that and all. I mean, consumables, the kind of patients you even get, you know. So it made the work much easier and much fulfilling in the private hospitals for me. I know people now still prefer working in rural areas, government hospitals. That is them. But for me, after the ordeal I went through, the delays in the healthcare, seeing patients die preventable deaths, I said, no, this is not for me. Yeah, this is not for me.
The brighter side of working where you are now is obviously better than where you used to be here in Ghana. But have you experienced any crazy days working there?
Yes, not to say that the workload here is any easier. No, the workload is quite a lot here because NHS is free. Healthcare here is free. So you have a lot of patients compared to other countries where healthcare is quite expensive or you pay out of pocket. So people don't go to hospital as much. Here it is free. So the least in headache, they are in the hospital. Flu, they are in the hospital. My leg aches, I'm in the hospital. So it's quite heavy here as well.
Not to interrupt you, right?
Yeah.
Hold up. Sometimes I read on social media where people are complaining that sometimes they go to the, I mean, they relocated abroad and then they say that sometimes when they go to the hospital, they are turned away. It's easier in Africa. You will get attention,
Okay.
but over there,
Yeah. So access here, the access is there, but the waiting time because of the numbers. So you don't just get up and say, I'm going to see a GP like you do in Ghana. You have to book appointment to see the GP because the GP is supposed to see cold cases. Cold cases are non-emergencies. So if you think you had a cough, not no fever, no temperature, nothing, I mean, that you have to call in as an emergency. You can call a GP, okay, I think I'm having a cough. When is appointment? Maybe in 2 days' time or 3 days' time. Some even don't get appointment this week, maybe next week. So depending on what it is, then you go to the GP. But if it's something that is quite an emergency, chest pain, impending heart attack, whatnot, you don't call GP, you go to A&E. Ambulance service is also free here, so people use the ambulance a
oh,
lot. Oh,
ambulance,
it's free.
ambulance
Yes,
service,
it's
it's
free. Yeah,
free. You don't have to. You don't have to buy your own diesel, and they will
you
come and
don't
carry
pay
you.
a penny.
Wow. Anyway, Alison,
You don't pay a penny. Hey,
it's
baby,
something exciting.
don't fall. Come, come, come to mommy. It's okay.
Oh,
It's okay. It's okay. Yes, darling. We are doing an
if
interview.
you have any questions, please put them in the comment section and we'll ask you questions. And
Hello.
then in a short while,
Hello,
we'll be out
baby.
of here. But while Alison nurses her baby, please do double tap the screen
Hello. Oh,
and
really?
then, I mean,
Say hello. Say
do follow this
hello.
account. And what else? What else did you say? Double tap the screen, follow the account. If you have any questions, please put them in the comment section.
Yes,
And in a few minutes,
baby.
we'll be out
What
of
do
here.
you want?
So, Alison,
Yes, darling.
hello, Aya, please. You'll be going soon. But please spare us
Hello.
for a few seconds and then you're out of here.
Okay.
What would you say about the remuneration?
Okay.
Well,
Of course, it's better than back home. UK nurses are not the richest, but depending on not where you work, your band, as in your level, and where you work, as in the area you work. I'm talking of. London, inside London, outside London, and all of that, because the money is quite different based on your location as well. Those within London get some extra money for high cost of living, because the cost of living in London is quite high compared to those in the Midlands and the North or the South. Yes, baby, don't pull it down, okay? So yeah, depending on which area you work in, and also your band. So the higher you go, the more your money. Yeah.
Well, as in, we definitely should do this again. We should do this
Oh,
again
are we
when we
ending
get.
already? Because
Oh,
of
you can
Aria.
go on. I thought, yeah.
Maybe about 10 minutes more or 5 minutes. I can
Okay, so
manage her for now.
let me ask if there are any questions you want to put a question in there so that Alison can answer these questions for you.
I
But it's
see
good
my
to see
another
you.
friend. Mo
Okay,
Shatta, Mo Shatta, Mo Shatta. Nidako.
good to see you.
Good to
Okay, that
see
good to see you. Thank you for joining.
you.
Boozy Akins, thank you so much for joining. Akosiana and Alexis, Obenewa, please let's do this sometime. Let's collaborate soon. Thank you so much for joining. JB, thank you. Please, the TikTokers would say, "Oh, double tap the screen, follow this account, whatever
This is
they
my
say."
first
But I'm saying
ever
this.
TikTok live.
Oh, okay. It's my second time. I think
Oh,
we
okay.
are getting
It's
this
not
alright.
bad.
We're getting this
Yeah,
alright.
it's not bad. Yeah,
But,
it's
but
not
really,
bad.
thank you so much. Okay, there's a message. Let me check it out to see. Where do I read this thing? Hey, I can't find it. But anyway, I hope to see it soon. I hope to see it
I
soon.
saw a message thing, but I don't know where it went
I
to.
saw it. I don't know where. Let's see. I saw it too. Okay, so someone says, "Hi, please. I have my UK NMC pin, but I am struggling to secure a band 5 role. Can you please help?"
So, like I said, it's very difficult now because of the restrictions. Now, the person has a pin, NMC pin. So
Yeah.
what he should do is try and go to track jobs. I'm sure he's been doing that already, but trust me, it's difficult. Even before I came, that was 3 years ago, I did over 200 applications. I just one interview,
You're
just
kidding.
one interview. I'm serious. I could do 30 applications in a day. That was the days that I was not working. I could do 30 applications in a day, but I got just one interview and that brought me here. So it's difficult now because they are not recruiting from overseas. So that person is a Fabrics Hub. That person
Yeah.
has done well to get a pin, but they should try and keep looking at any NHS's jobs. They keep posting. Now recruitment has gone down as well, but once you have a pin, it's much easier compared to not having a pin and then coming to start all over. So keep trying. Like I said, even 3 years ago, I did over 200 applications, just one interview. So don't give up because it can be very daunting. It can be very disheartening because you're like, you're getting, unfortunately, I'm sorry, we can't employ you, that. Some don't even mind you, but
Wow.
there will be that, yeah, there'll be that breaking point where a breakthrough comes. That one job would do the interview, and that'll be the one to, hire you.
Yeah.
So the person has done really well getting the pin. They should just keep applying, keep applying, keep applying. Definitely there'll be a way out. Hey, baby.
Great job. Wishing you the best. I hope you get. I
Yeah, I
hope you
wish her
get.
the best.
Yeah, I hope you do. And please, when you go, remember me. Oh. Okay, fine. That's it.
Some
All the best.
pounds. Yeah.
Yeah. So what else?
Yes.
What else is there to say? But I think it's been a great session,
Maybe
right?
somebody will be asking about specialty areas.
Okay.
Um, in Ghana, that we have some specialties, but we are quite limited. Over here, there are 1,001 you can think of. Things that you
Okay.
wouldn't think, oh, yes, like tobacco dependency nurse who, when patients come when they are excessive smokers, you take them to counseling, try to get them to cut off some nicotine and all of that. There's alcohol liaison nurses here. There's diabetes specialist nurse. So alcoholics who come to the ward, we refer them to alcohol liaison nurses. They also take care of them, try and let them stop, taking the alcohol to, you get what I mean?
Yeah. Yeah. Yeah.
um, Respiratory nurses, diabetes specialist nurses, clinical research nurses, clinical educators.
And
Like,
do you necessarily need a nursing degree to be able to do those jobs?
no, that's a good thing here. Once you have the certificate, NMC certificate, It means that you're a nurse with a registered PIN. I won't be surprised. No, I have bosses who don't have degrees.
And they are your
Yes,
boss.
they are matrons. They don't have degrees. They've just risen the ranks. And good thing here is there's no time limit on the ranking. Unlike Ghana, where from one point to another, they have to have worked 3 years or 4 years or 5 years to move from one level to another. It's not like that here. What happens here is that, hey, sister, somebody now did me say, take this one. Fako Diagro. Fako Diagro. Ompe. Jiwe. Fako Diagro. Fabra Happy Diagro. So what happens is that, go and bring it. What happens is that over here, once you see a job opening, let's say you're in band 5 and you see a job opening for band 6, you think you have the expertise or experience, try it, go for the interview. Once you impress them, they'll give it to you, no matter how long you have worked. When I came, I did band 5 for 1 year. I applied for band 6 and I got it.
Okay.
In Ghana, moving from senior staff nurse to a nursing officer could take you 5 years or 3 years.
You will
You
suffer.
have to wait. Yes, you have to wait. And I've seen there was one lady I was working with, she was a healthcare assistant. She moved from healthcare assistant to a band 6 nurse in a matter of 2 years.
You're kidding me.
Yes. She topped up with she did what we call associate nursing. It's like you're not a health assistant, you're not a nurse, you're in between. You can do certain nursing procedures and not all. Then she topped up to be a nurse. And the previous department she was working with, this dementia team, she was working as a dementia nurse. She was working with the dementia team before she went to school to, top up to be a nurse. The moment she became a band 5 nurse, 6 months down the line, they wanted a band 6 dementia nurse. And because she had worked with them before, she had the experience, they took her.
Wow.
Yes. So you don't necessarily follow the 5 years, 4 years. You can use 3 or 4 years to move from band 5 to band 7 or band 8. Once you can prove yourself at the interview, that is it. So the
Hey,
growth
that's
here is quite
phenomenal.
phenomenal.
Yeah. And it's
Yeah.
inspiring. That in
It is
itself is an
inspiring. It is inspiring, honestly. It is really inspiring. They give chance to everybody. They don't say, oh, you don't have a degree, you don't have a master's. Most of the people here don't have masters.
You did your master's, right?
Yes, I did before I went. Most of the people here don't have masters. Some have just diploma in nursing. They've got their certificate to work. They've, grown in the job, gathered experience. They've become ward managers. Next thing you see, they are matrons. Nobody comes to ask for your degree. Sometimes when they're advertising their jobs, they say degree is an added advantage, but it won't stop them from giving the position if you've proven that you can do the work. Yeah.
Right. Right. It's great to see you.
Princess Ode.
I was saying the system is working. Indeed, it is working.
It
And
is.
a county
Hey,
called
I see my husband there.
Okay. Hi, hi, Alison Hubby. Thank you for joining. Wow, amazing. Now let's talk about dependence. Immediately I saw his comment, it came to mind. When
Yeah.
you were going, did you get
Give me a.
opportunity?
I'm listening to you. I'm just putting it in the pen. Go and play in the
That's
pen, okay?
okay. There's
Play with
another
your
message.
friends. Yeah. Play with your friends. Good girl. Good
Okay, so
girl.
if you just
No, no. What's
joined,
your
this
friends?
is Candid Chat with Jackie, and we've been talking about Alison's experience working in the UK as a nurse, relocation, and all that good stuff.
Hey,
Amaya is
come on,
saying,
yeah.
now I'm going to get husband. God, I beg, oh, God, when?
Oh
Anyway,
my god.
so you got to I don't know how that worked, but I know that your husband is also over there with you.
Yeah.
There was a question about dependence, like how do you get to like tell us about it.
Yeah. So what happens is your sponsorship. We call something certificate of sponsorship. You hear people say COS a lot. It's certificate of sponsorship. So your employer gives you that, and that's what you use to get your visa, and that covers your immediate family, so your husband and children. It does not translate to mother or father or siblings. It's just husband and children. Good girl. Good girl.
You can make it, but you get to experience all this on Candid Chat with Jackson. It's not just
Um,
us, but with your family. everyone that comes with that. Oh yeah, I'm looking forward to hosting you one of these days. I hope you say
Yeah,
yes.
you should. You should.
Right? Yeah, we
Daddy's
should. We would.
here.
Anyway,
Daddy's
so
here.
Alison, thank you so much for
We can
coming.
continue. Daddy's here to
We
take
can
care of her, so we can continue.
now
Daddy's
let's talk
here.
about some other
Hey.
things, right? Let's talk about some other things. So you've been married for like how long?
5 years this year.
Okay. And working in the UK, you don't I mean you have a child, your husband is there. And
Mm.
how many shifts do you work? What is a typical work shift?
Working. Okay. So for nurses here, we do 12-hour shifts, and you do 3 days every week of the I mean every week of the month. Then the last week of the month, you do 4 days. So you work 3 days, then you have 4 days off for every week till the last week of the month. You do 4 days and have 3 days off.
Okay, compared
Yeah.
to Ghana, how
Oh,
many
well, when I was in Ghana, I was still doing 12-hour shifts. So it was an easy transition for me. But most hospitals in Ghana do 8-hour shifts. So morning, afternoon, and then night shift. It's only the night shift that was 12 hours in Ghana. But Trust Hospital, we're doing 12 hours. So it wasn't too much of a bedding switching here because I was already used to the 12 hours shifts.
now let's move
Yeah.
a little bit away from nursing, right? We've been enjoying the conversation about nursing and relocating and all that.
Yeah.
Now let's say if you were in Ghana, your mom is still okay. Someone is asking, locum day UKP, he's asking
Oh,
for that.
yes. Oh, yes. Locum day. We call it bank.
Okay, so those who
Banking.
don't know locum, what's
Yeah.
locum?
Locum is extra shifts, working extra hours. Yeah. So as much as it was in Ghana, you can some people were moving from government hospitals to do locum in private hospitals. And those in private hospitals got to do locum in their hospitals. So if there's a shift that they have adequate nurses for and they put out that shift, then somebody can say, okay, I'm free, I can do that shift. So that's what we call locum. We have that here as well. So we call it bank. So I'm doing a bank shift. So if there are extra hours, extra days you need to, I mean, you want to get some extra money, why not? But they have a limit to how many shifts you can do in a week so that you don't overburden yourself.
Okay,
Yeah.
well, that's
So they
fine.
are quite strong here. You can't do 24-hour shifts, no. You can only do one shift at a time, and you
So
can
you
do a
don't feel
certain
like
number of hours in a yes, yes, yes. Because they believe that if you are tired, there'll be errors. So
okay.
as much as possible, even though they want people to cover the shifts, you can't risk bringing you to come and I mean give us errors because people's lives are at risk. So they have a limit on the number of shifts you can do in a week.
So I want to ask you a question about help, how you get
Yeah.
help. You are married, you have a child. I'm sure your husband goes to work. How do you get? Because
Yeah.
there are some people here who are seeking opportunities there, and they
Hmm.
are wondering, how am I going to do it? How am I going to leave my child with? In Ghana, you have like even
Family to I mean to rely
readily
on. Even
available
teachers can
support.
help you and all of that.
How is the situation like over
It's
there?
difficult. Childcare is difficult and expensive because
Mm,
you don't have family like that unless you were born here. Even those who were born here have challenges sometimes because it means today your child will be with this person. Okay, we'll be with my mother-in-law today. On Tuesday, you'll be with my mom. On Wednesday, you'll be because everybody's working class. So it's quite difficult to, I mean, handle childcare, especially when your child is not in regular school yet.
mm,
So if you are doing jobs, if both you and your husband are doing jobs that are shift jobs, and you're able to work around your shift, that helps. They are child minders, but of course you
yeah.
pay. Those so they are like babysitters. We call them child minders here. They are babysitters. They charge per hour. Some charge depending on which area you are. Again, some charge up to from between £8 to £14 per hour or to £16 per hour. So the longer they stay, the more you pay.
Okay.
And some to have a facility where you can take the kids to. So their child minding is a facility. Other kids come there. So you come and leave your child there. When you close from work, you pick them. And there are nurseries as well. That's also paid. And to some extent, paid for those who are not citizens. Let me put it that way. Those who are citizens pay some amount, but government subsidizes for them. So they don't pay the full amount. Yeah. Yeah, but it's difficult. It's difficult. It's not easy. It's not easy. You know, back home, most of the men would go about their jobs. Women will take care of their kids. Mothers will come and help, grandmothers and all of that. But here, all inclusive,
All hands on deck.
all hands on deck. Otherwise, it is extremely difficult. Either you are all hands on deck or you are going to pay.
Wow. Is this
And
the
it's quite,
place where you
it's
give
not
your
cheap.
husband his two? Is this the place where you give your
If
husband his two? Is it the place? Is it a good opportunity to give your husband his shout out for being hands on?
he's taking care of baby, he's taking care of baby. So now I have
No,
so
this
yeah,
is what we are talking about.
shout outs to him. Yes, yes. Oh, he's
Exactly.
extremely helpful with that. Extremely helpful with that. So as much as it's difficult, it's quite it lightens the burden because he's extremely helpful with that. Yesterday I had to leave them at home and go to work for the night shift. Yeah. So as much as it's extremely difficult, he's very helpful. So it makes it quite lighter.
So let's just pass this note to the men who don't want to
Ooh,
be hands on with their babies, who want to go, even though you want to go
you
abroad,
have to
but you don't want to
learn.
help. You please, oh.
You
Am
have
I
to
out? Chairman is
learn.
making the brotherhood
Chairman is making, oh,
proud.
of course. Honestly, your brother is. He's making the brotherhood really proud.
Yay! It's good to know. It's good to know.
I have
Now,
to do insurance for him.
absolutely, absolutely. Now, let's talk about do you know that some people I used to hear that there were agencies in the UK who recruit people for care jobs, and
Yeah,
I know that
yeah,
it's something that most people in Ghana like, but
yeah.
I understand it's no more active.
Mhm.
What's the peak
So
with that?
what happened was agencies were recruiting for care homes. I mean, from Ghana, you didn't have to be a nurse. It could be anybody. You just have to. I think I wasn't sure of the requirements, but I think they can bring any. I don't think there was English requirement even needed. They
Okay,
just employ
you need
you,
a
give you
IELTS.
certificate of sponsorship. I don't think so. I don't think so. I'm not. I stand to be corrected, but I don't think so. Certificate of sponsorship to come in and all of that. But what they were doing is they were selling the certificate of sponsorship, which is not supposed to be so.
Okay.
The certificate of sponsorship is supposed to be applied for by your employer. So they do that for you to be able to get your visa for you. And the employer pays um I may be quoting the wrong figures, but it's a little about £1,000 for about a couple of years. Then based on the number of years they are giving you for your visa to cover. But because people were desperate to leave Ghana, people took advantage of the system. Were charging £14,000, twenty
And
thousand
people
pounds
were
to be a
picking.
dependent. Yes. And what people did not know was that once you have COS, it covers you and your family. People did not know that.
It's a
So
market.
one COS, they sell to two people. Like, if you want to go with somebody, then I'll make it cheaper. So it's £20. But if you allow for somebody to go with you as a husband or wife, we make it £15,000. And they didn't have jobs for the people. So they bring you in without the jobs because they just wanted to rip you off the money they were providing, and because people were desperate to leave Ghana. So they come in and there are no jobs. And even the system requires that once you are in as a carer, you're supposed to do not less than 20 hours. They were not even getting that to do. So eventually people were dormant, are not paying their taxes. Most of the agencies were shut down because the government realized that they were just fraudulent people, milking people of their monies. So once the company that brought you is shut down, you don't have an employer here. You have to go back home when your certificate of sponsorship dies. Yeah.
Wow.
So a lot of people are returning. They're not telling you the real reasons why they are returning, but this is one of the reasons why they are returning. Their companies or agencies that brought them have been shut down because they are not legit, or they were just duping people of their monies. And even now, education, previously after you do your master's or education, yeah, they give you up to about 2 years to find a job. They reduce it to, I think, 18 months. It's extremely difficult to find a job now because a lot of people infiltrated the system. I don't want to mention names, but some of our brothers did the system dirty. So it has
Yeah.
blocked a lot of holes here. Immigration has
I
gotten
think
so tighter.
I think this person is just joining, so she may have missed what you said earlier. But she
Yeah.
wants to know: can I get an employer to employ me as a nurse in Ghana?
You
If you
might have to write your CBT, your IELTS, and then if you have money and you can afford, come and write your OSCE here. Because now they are not recruiting nurses from overseas, regardless of where you're coming from. Because in the past they did a lot of recruitment from Africa, India, Filipinos. Oh, they are some of the lovely nurses you work with. Very
The
hardworking.
Filipino.
Yes, yes, very hardworking. The Indians, they are very hardworking. But now they've stopped all recruitments from, I mean, overseas, and they're recruiting locally. Yeah. So if you don't have your PIN, it's difficult to get a job. Even with the PIN, it's still difficult now, but it makes it one step ahead of those who don't have all the exams written out and their PIN, having their PIN. Yeah.
I think you just touch on the fact that
Isaac
the
says
number
people can raise
of
14K for a visa. People sell their
exactly.
properties. People have sold their properties, left their well-paying jobs for,
Oh, okay.
sorry, a call came through, sorry, only to be hit by this. And then eventually they have to go back with their families. So those out there, this is just a sound of caution to those out there. Don't let anybody lure you. Now there's no carer job or anything of the sort. People come in and there are no jobs. They blocked that channel, and it made the government even put a price cap on it. If you're employing somebody from overseas, a skilled worker from overseas, you should be able to pay the person a certain amount of money before they can give you the certificate of sponsorship to apply for visa. And the care jobs cannot pay that amount of money. So it's one way of blocking that avenue. Yeah.
Okay, so this is going to be my very final question. We would have been done in
Okay.
1 hour. But before we go, please double tap the screen. It's just showing some love. Alison, there's this phenomenon where people say that it's difficult abroad, oh, don't come, oh. You know what you people say. You people say. If it's difficult, why
Ahanye,
don't you
ahanye,
come?
mahumba, ahanye, mahumba.
But you are still there, right? What is going on?
Okay. I'm not, that's not me saying, I'm just saying what people are
Okay,
saying.
right.
What is happening is people have realized that it wasn't as easy as they thought. This country, there's no free lunch. You work for your money. You
Mm,
want extra money, you do extra shifts. The weather is not favorable.
mm,
Imagine waking up to -2 degrees. It is so cold. You have to catch a bus to go to work.
mm. That's
So
not
there are a
bad.
lot of odds. It's not nice at all. Oh. I know what they're doing.
Mm.
After work, I want to do me. Hey, DJ Amachi, nice to meet you.
Hi, DJ
It's been a long
Amati.
time. It's been a long time. Yeah, so people say that because in the past, people have perception that Abochi was all rosy. You go
Mm,
to work, you make a lot of money, you send money back home, and all of that. You make the money, but it's not free money. You've worked for it. The weather is not conducive, like I said. It's raining, you are going to work. It's snowing, you are going to work. It's sunny, you are going to work. Whichever weather it is, you are going to work.
you can't say that it has rained. It's just there's your area has flooded, so you calling that you are calling in to cancel. You can't say that.
Say
I was saying that.
Katine. Mm.
Okay, I was saying that over there you can't call and say that it has rained, so I won't come to work like we do here. Some people do
No,
here.
please. No, please. What what um what happens is it depends on level of damage. So maybe it rained, you were going to chase a bus, you fell and slipped, so you can't come to work. That makes it. But not it is cold, I can't come to work. It is raining, I can't come to work. My house is flooded. It doesn't happen here. I can't come to work. But if it has to do with injury, maybe the floor was slippery, or it had snowed, the floor was slippery on your way to work and you fell, that they can pardon you, but not merely because of the weather. No.
So has it been worth it
Yes.
relocating?
Oh
Hey, is
yes.
it
Oh
yes for
yes. Oh
me?
yes. Oh yes. If for nothing at all, the way the healthcare system works here, I have enjoyed emergency, I have enjoyed delay, but I will still take this place over Ghana because, and also because maternity leave, you can go up to 1 year.
And you'll be paid. Come again. You'll be
Okay,
paid.
you'll be paid for 1 year, but you get some money to some point and then you don't get money again. But at least it gives you a lot of time to figure out childcare and all of that. Some people return after 6 months, some do after 9 months, some stay up to 1 year. I stayed up to 1 year
So
before I
for a
went back
year
to
you
work.
weren't working. Wow, that's so cool.
Yeah.
Nice, nice.
So those are some of the things that you get here that you don't get back home. Free healthcare. And trust me, if they find something that seems suspicious of anything, you'll be overwhelmed by the rush.
Wow.
Yes, you'll be overwhelmed by the rush. I don't want to give details, but I have experienced that. Not because I'm a nurse, but I experienced that as a patient.
Okay.
You
Okay.
The way they take care of you, nobody's talking to you about money. Like how much money? No, nobody's asking you about money.
Yeah.
Nobody's asking you about where do you come from. No, they take care of you. If they realize that you are an overseas visitor and you just came to visit and you had an emergency, then they would refer you to the overseas team to handle payments. Nurses don't talk about money. Doctors don't talk about money here.
Okay, I have some comments here. Let me just, I think you would be interested in this one. We are saying, even in 15 degrees AC, we are wearing suits and drinking hot beverages, is it? And Ella was asking, which country is being discussed? We are talking about the UK, Ella. And Debbie is
Yeah.
also in the UK. She's saying that the bus system cry alone. I won't go back, shy.
Yeah.
If
Yeah.
you have a rich
You
husband,
don't feel bad not having a car here. You don't feel bad not having a car here. Well, it depends on where you live also, sorry. Because in London, the bus system is quite, I mean, it comes every few minutes and it's quite a lot here. In the hinterlands or into the other areas, it comes every 1 hour, but it's still working anyway. So if you don't have a car, you can still manage to
where do you
survive
live?
here.
If you don't mind sharing.
East London.
Okay. 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 So this is just to say, not every part of the UK is London, I guess. Okay, you are London, oh,
Isaac
when you
Amoyal. Isaac Amoyal.
I wonder what Debbie was talking about, what Debbie meant about the bus system. But I think, well, oh,
I
Alison,
think
there's
she
a
means
comment.
it's working. I think
Oh,
she means it's working, yeah. How
Ella
much
says,
do
yeah,
they
do
give
they?
the UK for childbirth?
I'm new to this. I'm learning a lot.
Um, for childbirth, they don't. Okay, so when you are pregnant, they call something maternity pay. So they give you some money for being pregnant. Well, I mean, whilst you're on maternity leave, they give you some money for maternity leave. Yeah. So I'm not. I've forgotten how much. I won't be able to open my payslip to
Someone
give
says
details.
wonderful.
They give you some money, but just know that you're not going to have your full salary for all the 1 year. No, you have full salary to some point. They half it, they give a quarter, but in all of these, they are still paying you maternity. I mean, money.
Yeah.
Yeah,
Wow. The way the comments are
yeah.
coming, it's like they don't want us to stop this live.
I
Great
know,
to have you
right?
today. It's good to have you, whoever you are. Please kindly double tap the screen and kindly do follow if you don't mind.
Hey,
Someone said, I mistakenly pressed the emergency button, and if you see how the man spoke to me,
hey,
you won't
it
come
is
back to Ghana.
beautiful. It's just
Wow.
beautiful. Like I said in the beginning, it is a sight to behold, Jackie. You just be standing there. You
Mm,
don't know whether, hey, emergency near first day.
mm.
Oh, it
Meanwhile,
is
in
just
Ghana,
beautiful.
Meanwhile,
Hmm.
in Ghana, just describe the scenario for those of us who have not gotten the opportunity to experience emergency in Ghana, so we have a sense of what you're talking about.
So emergency in Ghana, you rush a patient. You are rushing the patient in the first place. You're
Is
rushing
it
the
the
patient to the
patient?
hospital.
No, is it the nurse rushing the patient or the one who
No, so
brought
I'm
the?
giving two scenarios: bringing the patient in, and then while the patient is still there. So bringing the patient in, you bring the patient in, then you rush the patient to the hospital first. You look for the A&E in whichever hospital or their OPD or anything, depending on what hospital it is. Then you tell the nurse, I brought somebody, I brought somebody. Then if they have trolley, they'll go for the person. If not, they'll tell you, okay, depending on which hospital. Yes.
Wow.
So I'm not saying trust hospital. No, 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 no. We weren't doing that there. It was quite top notch there. But government hospitals and all of that. Fancy wheelchair na fanebra. Then they are not going to fancy have chair. Yeah, they remember. You need oxygen. No. If somebody requires, they need oxygen. No. Ambulance oxygen room. This is a oxygen. No. Leave the ambulance bed. Leave this. Leave that. And even me as a nurse transferring patient to tertiary hospitals, like I won't mention names. I had suffered that before. Once returned a patient back to Trust Hospital because they said they didn't have oxygen and the oxygen in the ambulance was running out. The patient needed it. So I had to take the patient back to Trust Hospital because I couldn't leave the patient there without oxygen. So imagine if the patient went there on his or her own. Now, in the hospital, when there's an emergency, some hospitals don't have the call buzzer. So it's a relative shouting that, Mum, bro, BB, you know. Or maybe a nurse has seen it and calling for help. But how many nurses do you have in a ward? Maximum 3 or 4. Then they are now going to call a doctor. That is if there's no doctor on the floor. They're not going to call a doctor before they come and ascertain that, before bring me this, bring that, running around doing that. No.
No, that's
Here, full call buzzer, finish.
that's all.
When I go and see a patient having seizures or patient I think having a heart attack, there's an emergency call buzzer. I just pull it. You don't leave the patient. Stand there and pull call buzzer. Everybody will come. If there are typically about 5 or 6 nurses or 7 nurses working, and you are not in the middle of a procedure for a patient, once you hear call buzzer, nobody has to tell you that you can't be working about, hey, who is buzzing? You stop and go. Doctors, we have a lot of doctors in the ward during the day, a lot, plus consultants. And it's not just them. There's an emergency team who gets bleeped anytime a call buzzer goes off. There's a critical care team who also gets the bleep when the call buzzer goes off. So once it's not a false, even if it's a false alarm, by the time you blink and open your eye, there are a lot of people there. So if it's not a false alarm, you leave it going for a while. And when we are coming with things. There's a trolley. It has all the emergency medications. It has the defibrillator sitting on top, suction tube, suction machine, oxygen bag, whatever. So you are coming, one person rushing to the scene is coming with the trolley. So you're saying that somebody's coming to stand there. Hey, could it be this? Could it be that? I want syringe. No. Everything is there at the time we need it. The emergency team some are coming from theater. They have things to intubate patients already. They are coming with it. So you are now going to run around asking for, where is this? Where is that? I want this. Give me, how do you call it? All those emergency medications. No, everything is there. So, like I said, it's a beautiful sight to behold. It's a beautiful sight to behold. And most of the time, the people survive here.
Wow.
Most of the time, they survive. And there are people, one difference I want to talk about that we don't have in Ghana, those who do not want to be resuscitated and those who want to be resuscitated. There are people who have terminal illness like cancers and they are old and all, because if you resuscitate them, their quality of life will be low. So they sign a form, do not resuscitate me. So if you know that and you are the next taking care of the patient and the patient has an emergency, you don't pull a call buzzer.
Okay.
Because you're not going to resuscitate the patient. So based on if it's a cancer patient, you refer to the palliative care team. We have comfort medications we give to them and all of that to help them die, not like to kill, to help them die, like to give them comfort before they die. Yes. Unlike here, Ghana, they don't want to talk about death. So if somebody even has cancer, and let me refer you to palliative care. Hey, okay, and the person dies without the comfort they need. Yeah. So those are the two differences.
Trust me, we could go on and on and on and on. I saw someone say, okay,
Yeah.
wow, everybody would come. May God help us in Ghana to reach there. My prayer for Ghana
Amen.
is that we get to that point where we have a better healthcare system. It would make our lives a ton better. And so,
Yeah.
if you go on your knees to pray, please say a prayer for Ghana.
Yeah, I do because I have relatives in Ghana. I don't want Ghana to happen to them. I have loved ones in Ghana. I don't want Ghana to happen to them. So I do pray that our leaders who travel a lot they've seen all the things here. Some things are very basic that we don't have back home. Very basic.
The big
So I
institutions
pray.
would think they would have these things, they don't have. May God help us.
So I pray that with time they would be, I won't say more enlightened, they would have the compassion to give Ghanaians what they deserve so that our life expectancy will go up. Because you can see a 97-year-old woman going to the market by herself here.
and it's normal.
It's normal. You see them one. Sometimes I feel bad. Hey, I'm real sniffy.
Anyway,
They come person me full bass, person me nante. Oh nante.
oh
Yeah.
my days. Anyway,
Yeah.
all right. Alison, thank you so much.
It's
We
been a
said we were going to
lovely
be back.
conversation.
Here we
I
are.
know, right?
We passed 1 hour. Thank you. Thank you so much.
Thank you,
And this is we were
Jackie.
really talking about nursing. So imagine we were talking about, things that things you love, things I love more than
Yeah.
you can
We'll go
imagine how
3 hours.
I'm telling you. But before we go, please
Yeah.
everyone, if you're on this live, just double tap
Where
your
are we double
screen
tapping?
up.
I don't even know where we double tap.
Just
Oh.
I don't know why, but they told me to say the same thing. So I'm following the seniors, the TikTokers
Oh,
now.
I saw I double tapped on you because when I tapped on me, something else happened.
Hey, okay. So yeah, I'd like to say a very big thank you to you, Alison, and to every one of you joining. I saw Amoyal passing through Mr. Fadi, Debbie, Claudia. Claudia says insightful conversations. Thank you. So many people. I wish I could
Mo
mention all of
Shatta, DJ Amachi, all of
DJ
them.
Amachi, thank you so much.
Yeah.
Thank you, Samson Donko. Thank you so much. You all, wherever you joined from, please let's do this next week right here at the
Yeah.
same time. It's Candid Chats with Jackie. We talk about real, raw, candid conversations only. My name is Jackie Hansen. Until next week, please, I'll see you soon. Bye bye.
Bye.
Bye. Thank you so much, Alison. God bless
It's
you.
been a pleasure,
Bye.
Jackie. Thank you for having me.
Bye. I wish I could see these messages. I can't see them. Bye bye. Anyway,
Which ones? Don't they pop up? Yeah,
yeah, I
some.
see one new message. I don't know where the message goes to. I need to figure this thing out. So,
I think
let's see.
it goes into the live.
The chat. I
Yeah.
don't know. I need to figure this. I need a whole tutorial on how
You
to
figure it
go
out.
about. Yeah, with time, I guess.
Because I
Anyway,
know someone says because I know maternity leave is not 1 year in UK everywhere. Really, you decide what you want it to be. You don't necessarily have to stay for 1 year. You can shorten it, but it's 1 year. You're allowed to stay for 1 year.
oh, okay.
Yeah, yeah,
Well, well,
yeah.
and I guess it also depends if you have like the real documentation to stay there, or does that count?
If you don't have documentation, how are you employed? Well, I'm not sure of good. Maybe the person is talking about working in a care home and all of that. I'm talking about working in NHS. I'm not sure about care home, how long they give you. NHS gives you up to 1 year. After 6 months, you can decide to come back. After 9 months, you can decide to come back. You can wait till 1 year. That's fair enough.
But I said bye. But before we go, how about those in like the real corporate, like not nursing, not in the NHS, but like corporate,
Yeah.
corporate? How are those
Honestly,
ones?
I'll be giving wrong information, but I don't think it's any different for them as well. Because I know I've taken care of patients who had stayed for a while.
Mm.
Yeah. Who have stayed home for a while. I'm not sure. Maybe because they are private corporate entities, they may have their own restrictions and all of that. But otherwise, NHS, let me talk for what I know. NHS gives you up to 1 year.
Okay. Someone says the
People
secure
going on.
landing. Well, you can say that, but well, once again, Alison, thank you so much for joining. It's a wrap. Bye.
Thank you, Jackie, for making
Bye,
me do this.
everyone. Bye.